Now to our NBC News investigation. Millions of patients may have been subjected to unauthorized pelvic exams while undergoing surgery. Many never even found out. But now, as Stephanie Gosk reports, some doctors are sounding the alarm about this controversial practice.
Surgery can be daunting. Patients put their lives in doctors' hands.
Does a patient have the right to know what happens to them when they are under anesthesia?
Yeah, absolutely. Absolutely.
But according to doctors and medical students NBC News spoke with, sometimes surgery patients are given one of the most intimate procedures without their explicit consent, a pelvic exam.
On the surface of it, it seems like a violation of medical ethics, is it?
I would say it's a violation of bodily autonomy, certainly.
It may sound surprising, but Dr. Julie Kaur, an OBGYN, says the practice has been around for a while. Although exact numbers are hard to pin down because patients are often unaware, a recent study estimates that more than 3.5 million men and women may have received an unconsented intimate exam within the past 5 years. Dr. Kaur says the exams can be a key part of residents' training and may be performed during gynecological surgeries because it is easier, even if the patient doesn't actually need the procedure.
The muscles of the abdomen are more relaxed, so you can actually appreciate the anatomy in a kind of an easier way.
But consent should be mandatory, she says.
And I was asked to do a pelvic exam on a patient that I know I hadn't consented specifically.
Did you want to do it?
You know, no, I did not.
Dr. Rohini Kaushal is the head of the American Medical Student Association.
I actually ended up saying no, that I wasn't going to perform this pelvic exam.
She is among a number of medical students who are speaking out.
It's just morally wrong. If you were in that position, would you want that happening to you?
Attention to the issue has led to 25 states enacting laws requiring explicit consent for pelvic exams on a patient under anesthesia. The American College of Obstetricians and Gynecologists states that if the exam offers a patient no personal benefit and is performed solely for teaching purposes, it should be performed only with her specific informed consent. Some doctors have resisted the need for specific consent, arguing it's not necessary if general consent is given before going into the operating room, and the pelvis doesn't need to be treated differently than any other part of the body. But Dr. Kaur disagrees.
It's because if you ask a patient how they feel and whether they would want to know if a student was doing an exam, patients overwhelmingly say, yes, this is different.
And she says doctors should listen.
Because patients think it's different, I think it's imperative that we treat it differently.
Stephanie Gosk, NBC News, Chicago.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.